right, so this is our quality improvement project that we are starting at our facility, and it is the utilization of the laryngeal mask airway as a first approach to resuscitation in lieu of the facial mask, which we're used to typically a first step for our Mr. SOPA, but NRP definitely supports that NLMA will help to eliminate all those intermediate steps that we can go right to a laryngeal mask airway. We are going to be utilizing the 0.5 AirQ LMA for our project, and this will be used on patients greater than equal to 35 weeks gestation that you anticipate a difficult delivery, poor tone, meconium, limp, stunned patient would be ideal for this. Whenever inserting the laryngeal mask airway, if you have a pretty liquidy airway, that's great, but if not, applying some lubrication jelly to the back of your LMA is also helpful to glide that in. Never apply the lubricating jelly over the breathing apparatus. You're going to then put your head tilt lift. You're going to pull the tongue forward and then slide your LMA along the hard palate until you meet resistance. You're going to then apply your end-tidal CO2 detector and then start your breathing, and definitely allow it like 8 to 10 breaths to look for any kind of color change, improvement in aeration. Ventilation will be notable with your increasing heart rate, 8 to 10 breaths. If you're not seeing that color change, look at increasing your pressures. And then, go through it, what we're used to with our Mr. SOPA. If you see secretions refluxing up, you can definitely suction those out. But know with the LMA, you're probably going to need to utilize higher pressures than we're typically used to at that 20 and 5. You may have to go up to go up in increments of 5 to 25, 30, even 35. And then listen for that heart rate increase. That, as you know, 30 seconds of effective ventilation, you will have that increasing heart rate. And then when your patient starts to have spontaneous breathing that's effective, you can remove the LMA at that time and then go through just your NRP steps and support the oxygenation and ventilation as necessary. If you do anticipate your patient needing prolonged intubation, at that time you would prepare intubation equipment.